Good evening. Welcome to APMI's video. In this section, I'm going to be taking you through the clinical documentation aspects, where you can create your form, you can generate your documentation, and where you can generate templates for your hard assets. At the left-hand side here, we have the menu that says that you can select clinical documentation out of the list of the menu. So it brings you to the landing page of template template manager. So the title of the page says treatment template manager, and at the left hand side here you can see a new template button, and at the bottom you can see a table that will list out the list of all the templates we have. So the second tab at the top here says form generator. This is where we generate all our documentation form, and which we can create and edit. So I'll start with template manager. Click on new template. So under new template, we see the template type, the template name, the set visibility, edit by orders, and form, select form. So when you select the type, the template type, it requires you to choose if it is a documentation or an order set. First, I'll start with the documentation. So once I select the documentation, then I give it a name, malaria template. So with this template, we can easily create a documentation template for each of our procedures or each of our diagnosis or each of our documentation. So from here, I'll set the visibility, which says individual, facility, unit, global, or department. So this visibility simply means that, okay, who are the set of people I want them to be able to see this template? Is it individual only? Is it facility as a whole? Is it per unit? Is it global? Like you want another people using AppNames to be able to access this, or is it departmental? So you can set it to department. Maybe you only want the medicine department to be able to see this template alone, or you just want maybe the laboratory department to be able to see this template alone. So here I'm going to choose department. Now editable by order simply means, okay, orders that will be able to access this template, do you want them to be able to edit it? If yes, you check. And if you don't want them to be able to edit this, you can uncheck it. But I want them to be able to edit this. So here it says select form. So this select form simply means that there are existing documentation form in this facility before. So once I select form, it gives me the list of documentation form I have in the facility. I have clinic progress notes, continuous form, progress complete, another clinic progress notes, another clinic progress notes. So for the sake of this video, I'm going to choose this clinic progress note. So once I choose a form, it gives me the details of the form. That is, this form has been generated in our form generator before. So now once I click on this form, it brings me the details, what that form really entails. So here I have presenting complaints, I have history of presenting complaints, I have past medical history, I have family social history, I have past surgical history. So as you can see at the bottom here, I have next. So I also have review of system. All this is being set up in our form generator, which I will show you in the course of this video. So I also have next. So our documentation can come in form of pages. Instead of us having the whole list on the page, we can segment them, we can put them into sections. So we can put them in pages. As you can see, as I click on next, it shows me another page. As I click on next, it shows me another page. So until we see this button complete, so that is the end of the page. That means that is the last page that we can access. So the last page of this is examination page. So where we have the general examination, cardiovascular examination, respiratory system examination. So if we choose all these as a template, for example, my review of system, eye pain, cough. So my history of presenting complaints, my past medical history, family social history, past surgical history. So once I click on complete, it saves automatically. And it gives me this, on this list table down here, it shows me that, okay, I created the template in this date, 5/2/2018, which is today. And what is the template title? Malaria template. Documentation form, which documentation form I used in creating this template? It shows me clinical progress notes. Then visibility, who are those that can see this template? It's departmental. So it is only medicine department that can view this template. So is it editable by others? Yes. So basically all what I did here will be shown here. All what I did by selecting the type, template name, visibility will be shown in the table. So anytime the doctor wants to do a documentation in the doctor's page, they can easily call up this template and see what I wrote in this template during the course of this setup. So the second thing I'm going to be talking about is form generator. So in this form generator, as you can see, we have form here. So if I click on this form, it gives me the list of forms that I have already in the facility. So now let's go ahead and create a new form. For example, I want to say this is a nurses notes. What is the scope level? So scope level is the same thing as visibility. So the scope level of this, I want to set it to departmental. So what type of documentation is this? What type of document is this? It is documentation. So here, which module do I want to this documentation form, this form I'm generating to be visible to? I want it to be visible to Word, so that they will be able to make use of it in Word. I want it to be visible to clinic management, so that doctors and nurses can be able to access this. So here, at the bottom base here, this section is the designer section, where we can have drag and drop. So from here, I can easily drag comments and drop. So we name this to, let's say, past medication. We can easily increase the height from rows here. Let's put this to 8. You can see the height increases. And I can say, okay, I want to have another text panel that says, okay, allergy. So here, the nurses can list various allergy for the patients here. And if we don't want to do it like this, we can easily delete from here, delete question. So allergy has been deleted. And then we can easily drag checkbox. So in this checkbox, we can say, okay, I want this, the title of this checkbox to be allergy. Now, we have number 2 to be allergy, and then we have list of item under this. So this are the possible action we can take on each tool we drag from the designer here to the designer panel. Each tool that is present here can be dragged, and it can be dragged to this designer panel here. So each tool can also be editable by the menu at the right hand side here. So now I want to add up a list of allergies. If we come to choices here, from these choices, we can then list out the list of allergies we have under allergy. So this form is being customized with the form that exists in the facility before. Some facility makes use of paper as their clinical documentation form. So it depends on how the facility wants their form to look like, how they want it to be. Maybe you want it to be just checkbox to be able to check, okay, this, and that, or you want to type in. So these tools they are tools that you can use to create how you want the form to look like. So for example, this allergy, we want to have a list of allergy that we can just check, okay, this patient is allergic to this, to that, to this. So from the menu at the right hand side here for checkbox, I can see choices. So under these choices that is where we can list out all what we want them to check under this checkbox. So if I click on this icon, it brings me to edit property called choice. So it brings me, okay, item 1, item 2, item 3, same thing you have here. But a faster way of entering these items, you can see we have form entry and we have fast entry. Once you click on this fast entry, it shows you where you have item 1 to 3. Then you can now put in all your list of all the allergy lists you have. So that is, you can choose maybe a patient is allergic to antibiotics, tetracycline, penicillin, ampicillin, or aspirin, or sulfa drugs. So once you click on OK, the list will come here automatically under allergy. So another thing I would like us to see is remember when we are developing our templates on other set and documentation, we have them in pages. So we have page 1, page 2, page 3 till you see complete. So we can easily come here. This is for page 1. You can even name this page to be, you can name the page to be first page. First page. So if you press enter, this page title will change. So if you click on plus, that is, you are having another page. Then you can also drag and drop to this page. So I want to make this bigger. And I want to change the name to summary. So as you can see here, the first page will be the past medication history, past medication page, and allergy page. Then the second page will be the page for history page, summary page rather. So I have first page and I have summary. So all these tools here are the tools that you can make use of when you are developing your form. So you can easily drag and drop, make some tweak to it under the property menu here. This right hand side menu are property menu, and these are the list of tools that you can use to develop your form. So this this is a survey designer, which is form designer, and you can also have the test survey where we can test what we did, the design we made, the form we generated, the form we developed. So this is where we can test it. So we have the past medication uh, uh, dialog box that we can type in. Okay, this person may use paracetamol. Okay, the person is on tetracycline, or the person is on amoxil, the person is on aldomet. So where the nurses can type in stuff. So here too, we have the list of allergy where you can just check, okay, it's allergic to antibiotics, it's allergic to sulfur drug, it's allergic to insulin. So once we click on next, it takes us to the summary page. So where we can type in the summary we have. So this note can also be used in the Word. It can be used in Word Manager, as we see it here. It can be used in Word Manager during the word round. It can be used in clinical management when they are writing their clinical documentation. So once I click on complete here, it tells me that thank you for completing the survey. That is, thank you for testing what we just did. So now, if we want to save this form we just create, we can just click on Save Survey. So it saves. So if we come down to the forms here, it will be listed in this form. So we have this form, nurses note, under the list of forms we have for the facility. So if we click on this form, it brings us what we designed earlier. So we can make adjustments to it. We can even decide to delete this and still save. So once we save, we come back to the form here. So it brings us, okay, we now have only allergy. We've deleted past medication. And we have the summary too. So this form, we can use it to create, generate the form we make use of in the facility. And we can edit the existing form we have that we've generated before with this form generator. Another thing I would like to show you is the order set, template for order sets. Now, once we come here, we click on new template, we click on the type. Remember, we choose documentation the other time. So in this documentation, if we choose the documentation, this select form here, our nurses notes will also be there. If we click on nurses notes, we see, okay, allergy, next, summary. But now we want to deal with order sets. Now this order set, we can say, okay, I want to create order set for malaria. So every patient I'm seeing that is being diagnosed of malaria, that has malaria, I will make use of this order set to attend to the patient. So once we click on the order set, we can say, okay, the template name should be malaria order set. It depends. We can say, okay, we want to have order set for hypertensive patients. And we can say we want to have order set for patients that have been diabetic. So this order set simply means we can have in one template the list of our documentation, the list of our medication. You can have in this template the list of investigation we want to have for that particular template. We can have the list of procedures, and we can have our nurses care. We can also have a physician order. So in this, we can say, okay, for medication for malaria, we can say, okay, this person should use paracetamol. So once we search here, it brings us a possible option, possible search result based on the letters we enter into the search. So for example, I want to say, okay, this person It's using amoxicillin. So once I select a particular drug, give me chance an option to set the frequency. Is it 1 time daily or 2 times daily? So the duration, unit, is it per day, hourly, or per week, or per month? So the refill count and the start date. And we can say, okay, we can set a specific instruction. Here I have use with water. Then we add medication. Once we add this, it goes to the list of table we have here. And in this list of table, we can easily remove one out of it. So let me try to add another one. Let's choose this. Frequency, let's say 2 times daily. 2 hourly. Same thing, use with water. Okay, with cold water. Then I add. So now I'm adding these two drugs into the medication of this malaria order set. Whereas I can have investigation, whereby I search investigation, Widal tests, I had, it shows here. So it's giving me the service name to be investigation. The service name for the drug is medication. And the item I had is Widal. So let me try and add another. Okay, sodium, I had. Okay, this person will do full blood count. I had. So it's giving me the list of everything I'm adding in this table. Remember, we've not yet saved this order set. So now, if we have a list of procedure in the facility, maybe we are doing stress tests, or echocardiogram, or we are doing X-ray, the list of procedures, it could have been set up during our facility setup initially. So now the list of procedure will come down here. Once we search for a particular procedure, it brings it out the way we are choosing investigations in laboratory during when we choose investigations here. So the same way we can choose a list of procedure. So same way we can enter nurse's care, and we can also enter the physician order. So once we are done with all those and we had them, we file them together, then we can say we want to save this template. So once the template is being saved, so we can now make use of the templates, the order set templates during our documentation. So this will help the doctors, anytime they want to do their documentation, they can easily come to the order set and say, okay, I'm seeing the patient for malaria. Okay, I can just select my order set that has been configured in my template. So once the doctor chooses the order set of malaria, all what we enter under this setup, under this malaria order set setup, will automatically pop up in the doctor's page. So the doctor won't be stressing him or herself to now say, okay, I want to prescribe paracetamol for this patient. I want to prescribe this. Once he chooses the order set, the medication comes to the order set. The investigation, laboratory investigation, also comes with the order set. The procedure the person is to do under the order set also comes with the order set. The nursing care and the physician order also come with it. So this will ease the process of documentation of the doctors. Thank you. Thank you for this video. See you in our next video.